Hi, and welcome to the first video blog at the Learning Communities for the College of Nursing. I'm Dr. Janet McCabe, an assistant professor with the College of Nursing located in Prince Albert, and today I have with me Patrick Blais. And Patrick is going to talk to us a little bit about his experiences as a rural and remote nurse and all of the other wonderful things he's done in his career. Hi, Patrick.
Yeah, hi, Janet. Thanks for having me. It's a real honor and privilege to be here.
Excellent. So I thought maybe we'd start off and you could tell me a little bit about your life experiences that led you to being a nurse.
Okay, well, I've been nursing for 30 years now. I graduated in 1981 from the diploma program at SciAst. But prior to that, what I had done in the nursing profession was working in the capacity of a care aide and an orderly in a regional care center. Prior to that, I'm going backwards, but I attended University of Saskatchewan and almost completed 2 years of Bachelor of Arts, not really knowing what I was going to do with my life. So when I started working at the regional care center as a care aide, there was a male nurse, and he became my mentor over the 2 years and encouraged me to go into the nursing profession. Prior to that, I had some exposure in that I have 4 sisters and 3 sister-in-laws that are nurses. Family of nurses. I come from a family of 11, so I have 6 sisters and 4 brothers. So I'm going to backtrack to when I was young and some of the impressions that were made upon me by the nursing profession. And at the time, I cataloged them in my brain, and they came forward in that period of time when I was working in the capacity of a care aide and thinking about the nursing profession. Prior to that, I just cataloged it, and they were stories and memories that I had. So when I was 5, my father became very ill, and my baby brother was born, the baby of the family. My baby brother was born in December, and my dad passed away in April of the following year. So my mom was left with 11 of us plus the farm. So at the time of my dad's illness, I remember certain scenarios, and one of them was being allowed to go up to see my dad with my younger sister, who was a year younger than me, when he was ill in the hospital, in one of the larger hospitals in Saskatoon. So at that time, children weren't allowed to visit, and so we had a nurse who came and snuck us up the back stairway, and the doors at the time in the hospital rooms had glass inserts with metal. I remember the mesh, and she said to us to be quiet. I remember this just like it was yesterday, because she said to us to be very quiet, and she had gotten us a footstool so we could crawl into bed, jump up into bed with my dad. He was going to read us a story, and I remember looking back and seeing the door close and the nurse's head in the window with her nursing cap, and she was standing guard, not really knowing why she was doing that.
Until much later.
Until much later, when my mom told us that she could have lost her job, and that she was looking and standing guard and watching for the matron because what she had done was against policy.
Wow. So
that time that she gave us with our dad was has ingrained in my psyche, and it's always going to be with me in my mind and my heart, because we had an awesome time, read some of our favorite stories, and that was the last time we saw him. So that to me encapsulates the whole meaning, the whole purpose of becoming a nurse is the passion, the caring, and just going above that, above and beyond.
And it really speaks to that overall feeling of why people go into nursing, sort of that connecting and making sure that people have the connections, and not just that they're getting better, but that the family's actually healing as a process.
So, and the other story, and I'll just touch upon that briefly, and then we'll continue on. But when my dad's funeral, I remember the church was full in our local community, and my older sister, who is the oldest of the family, had just finished her training at St. Paul's Hospital, which was a 3-year Grey Nuns program at the time, and that So when we walked into the church, there was 2 pews in the Catholic Church, and they were that was my sister Jeanette and all her classmates. So my younger sister, who was 4, said, "Look at that! There's 2 pews of superheroes." Because at the time we were into Batman, Superman,
Yeah.
and so with my sister's class, they had the full uniform with the caps and the capes.
Oh wow.
And so my mom said to us, "Yes, they are superheroes."
Oh, those are such poignant stories.
So those things just have stuck with me,
and shaped your understanding of nursing.
yes, definitely.
Wow.
So when I embarked at Regional Care Center, trained right off the street, I had no idea what I was doing, no orientation. It was my patients that helped me through the process of caring for them. And then having the nurse as a mentor, I decided that's what I wanted to do.
Wow.
I
So
wanted to care for people.
So what did your career look like? What have you done? What exciting things have you done in your career?
Well, during my training, I just really enjoyed working with the older children. Pediatrics is one of my favorite areas. So there again, one of my instructors encouraged me, and I started working at Royal University Hospital right out of school, and was there for almost 9 years with the 4 and up age group. That's where I met another important mentor in my life, Ann Schulman, and she was our oncology nurse, and she was instrumental in starting a camp for kids with cancer called Camp Circle of Friends, and I always put a plug in because that's one of my passions. It's been running for 25 years.
And it's in Saskatchewan.
It's in Saskatchewan. It was on the shores of Lake Diefenbaker. Now it's being moved this year. But Anne was instrumental in pulling all the staff together and getting us all to volunteer for this wonderful camp that focused on fun for the kids and activities. So Anne was one of my mentors on PEDS, and the kids, of all the areas that I've worked, the kids were my best teachers. Mm-hmm. And it was a great place to work. I transitioned over to St. Paul's because we had a large patient population on our floor that were battling with cancer, and we had children that we cared for in the palliative stages of their life, and I really enjoyed that area of nursing. So I worked on the palliative care unit at St. Paul's.
With adults.
With adults. We had some families and children, and so I did that part-time for 2 years, and at that same time I stumbled upon contract nursing in the north. So by that time I'd been married. We've been married for 34 years, and we had small children, and so I just decided to try out a contract and see how that would work, and I fell in love with the north. So I did contract nursing for 10 years.
In northern Saskatchewan?
Northern Saskatchewan, Northwest Territories, and the Arctic.
Wow.
And I also did some occupational health and safety and some of the mine sites as well in that period of time. So I was self-employed through an agency, and just got to see some incredible communities, meet some incredible people, and worked as a primary care nurse for that period of time.
Do you think you could share one really poignant story from your northern nursing experiences?
I think in relation to palliative care, we had, in the community where a colleague of mine and I were caring for a patient who was in the end stages of her life, and was being flown almost weekly to the hospital to have procedures done in relation to her condition, and how she had said to us that she wanted that to stop, that she wanted to be at home with her family and die at home. So my colleague and I made arrangements for that to happen. A hospital bed in her living room. We provided palliative care and pain relief around the clock as part of our on-call service, although it wasn't really in our job description. But we provided that for her. And we were part of that whole experience, and we were there when she died with her family, all around her, guitars playing, singing.
Oh.
It was just an incredible experience.
So you guys really facilitated her deepest wishes.
Yes.
And supported the family along the way.
And if we had about 8 hours, I could get into stories about the emergency situations we were involved in, the medivacs and all the different situations, but that's maybe for another time.
But we'll save that one for another time. So I mean, you've really summed up your career path in terms of peds and your how you ended up or stumbled really into rural and remote and northern nursing.
Yeah.
I know now you're an instructor with Northlands College for their distance LPN program.
Yes.
So I mean, you've just had this incredible career.
Yeah.
Do you think you could speak to maybe a bit about how you've engaged yourself in professional development and with the nursing professions in Saskatchewan, maybe even across the nation?
You bet. Yeah, I just want to backtrack a little bit because I don't want to exclude the period of my career where I was the manager for a rural facility.
Oh wow! No.
And the importance of rural nursing and the service we provide in the rural sites in my home base, and I'm still involved on the front lines doing casual work when I can. That aspect of my career was invaluable, and I learned so much from my staff. And now that I'm teaching, it's just been a breath of fresh air. It just really has, and to see students develop and grow,
yeah,
it makes you so proud. It's just like being a parent, and when you're at the pinning ceremony it's just I can't describe it.
No, it's this incredible moment of pride. It's like you've raised them and shaped them.
Yeah, it's incredible.
The nurses that need to go forth into the world.
So I've always maintained that throughout my career the importance of continuing education, but also professionalism and getting involved with your local association and if in a work environment with your union. And I've always had good working relationships in those areas and was privileged to be part of the SRNA, a member of the board for 2 years, and incredible things that I learned in that process and the people that I've met. So I'm very grateful for that. And I would encourage students to be involved and be knowledgeable.
And students can be members of the SRNA.
Yes, and we had some incredible student participation.
And you learn about an entirely different aspect of nursing and the policy implications and the influence that nurses have at a level above patient care.
Yeah.
Which is so important.
And getting involved with extracurricular, like I mentioned before, that I was part of the marking sessions and session writing for the national exams, and was flown to Ottawa and participated in that. So there's so many things that you can get involved in. It's just been, I've never regretted for a minute going into the profession that I've gone into, and I have such passion and for people that I care for and people that I work with, and hope that I instill that in my students.
Definitely. You've talked a lot about the mentors in your life and
Yes.
the nurse that you encountered when you're working as a care aide, and the managers. I think it was the manager that you worked with. And it really seems to me that you've now become that mentor for a lot of people, maybe unknowingly. Is there anyone else that you think has really shaped your profession or your thinking about nursing?
Well, I think my family, my sisters.
Yeah.
And in a way, my brothers were there for me after my dad died, so I wanted to give that back, so I became part of the Big Brothers Association organization, and I was matched with boys in the 1980s, and they're still part of my life.
That's great.
One of my little brothers is a professor at the University of Saskatchewan, and I have another little brother who lives in Saskatoon, and he works there and has a wife and family now. So the importance of mentorship, I just can't stress enough. It gives you support, guidance, and just reassurance that you're on that right path. Someone you can call, someone that's there for you anytime, and it could be lapses of time where you don't communicate, but it's immediate. You have that relationship established.
Definitely.
Yeah.
And I think it's helpful for students to have mentors as well.
Oh, for sure.
Whether it's faculty or a nurse that they know, or
Yes.
someone that can help them ask those questions that they might not even know they need to ask.
Yes. And through the education process and being involved as a teacher now for the last going into 3 years, and it's motivated me and encouraged me to take my master's in leadership and with a health specialization. So I'm embarking on that this year through Royal Roads University.
Excellent.
Which is a distance blended program, and it focuses on group work and projects. So the 2 years, I'm really excited.
So you're living what you teach your students now.
Yes, I am.
Good luck.
A little nervous, but I'm really excited. I start that in April,
That's great.
and so I just can't stress enough the importance of no matter what age you're at. When I went to university and was doing my arts and science classes, that was way back in the 70s. There was one of our fellow students who was in her 70s.
Oh my goodness.
I think she was working on her 3rd or 4th degree, but her enthusiasm in our class in philosophy was incredible.
Probably infectious too.
Infectious, and she got us all young whippersnappers into shape and would pull us together as a group, and she was incredible. I'll never forget her. So yeah, really important.
I think you've really highlighted a lot of important things that people may underestimate about nursing. That it's more than just bedside care. It's about going above and beyond for families and making special connections, and the importance of mentorship in nursing. That just because you choose one path doesn't mean that's the path that you're on forever.
Yeah.
And especially the professional development and engagement, that you can never stop learning as a nurse.
Yes.
And you can never stop growing as a person.
And the importance of along that path to recognize other professions as well, and talk about collaborative care and collaborative and approach to caring for your patients with other team members, such as occupational therapists, physicians, nurse practitioners, PTs. So how important that is. In the north and in a lot of the remote communities, our circle of care also included our RCMP members and members in the community, because we were there for each other, especially in a crisis or emergency situation, and we worked together because that's who was there.
Yeah.
And so the incredible network of support that we created in those communities were vital.
Yeah, and really speaks to not only collaboration, but involving yourself in the community and
Yes.
with the nurse, be it the nursing community or a student community or your home community, but how essential it is to understand that community.
Yeah. And also the importance when you're embarking on your career, and even as a student, to find that balance and to care for yourself.
Definitely.
How important that is.
And it doesn't get any easier once you graduate.
No.
So we may as well learn it as students.
Yeah.
Well, thank you very much, Patrick.
Oh,
really
you're welcome. This has been great. Yeah.
Excellent.
Thanks for the opportunity, and good luck to all the students.
Thank you.
Okay.